We begin with news of another kind of virus threatening South Australia. Just as the country is in the talks of procuring and rolling out vaccines for COVID-19, there's another virus which South Australians are being warned about. It is apparently transmitted through mosquito bites. Our Regal News correspondent Dee David has more on the story. Dee?
Every year, the summer months pose new challenges for those looking to enjoy this time of the year, such as sunburn, crowded beaches, electrical outages, and bushfires. However, when it comes to mosquito-borne diseases, there are few and far between in Australia, let alone South Australia. This is why the arrival of a potentially deadly mosquito-borne virus in different parts of regional South Australia at the start of the year have caused alarm among the community. With the possibility of a serious disease endemic to South Australia looming over people's heads, health authorities have urged vigilance among those who live in high-risk regions. The first public health alert related to the possible diseases was made by SA Health on the 13th of January 2021, after 5 blood samples collected from chickens near the regional town of Menindee were tested positive for 2 potentially dangerous mosquito viruses, with the potential to spread to the human community within the Murray Valley. As a result, all residents of South Australia, particularly those residing in the Murray Valley, were urged to take all necessary precautions against the threat of mosquito bites. Residents are urged to wear clothing that covers the areas of the body at risk of mosquito bites, maintain the cleanliness of their property to avoid mosquito breeding, and to wear insect repellent outdoors. One of the viruses, the Murray Valley encephalitis virus, or MVEV for short, has been known to produce in humans mild symptoms of fever, headache, nausea and vomiting, or more serious health ailments such as encephalitis or meningitis, experiencing symptoms such as confusion, tremors, drowsiness, and seizures. Several months are required for recovery from mild symptoms of MVV, with 40% of survivors experiencing permanent neurological damage and a 20% mortality rate. One positive trait of both viruses, however, is that they are not known for having the capacity for human transmission. However, this does not mean that the residents of South Australia can lose vigilance. All those with relevant symptoms and a history of mosquito exposure are advised to be tested for relevant diseases. All residents of South Australia are also constantly reminded to be mindful of these potentially deadly viruses and to take the necessary precaution in order for the summer months to be enjoyed to the fullest. Reporting from Adelaide, Australia, this is Dee David, Eagle News. We live in interesting times.
Thank you, Dee. Let us all take good care and be vigilant.